Thank you, Ceann Comhairle. Minister, in Ireland, cancer remains one of the leading causes of death, and timely access to new and effective treatments is crucial for improving the survival rates and the quality of life for patients. However, delays in accessing these treatments has become a significant issue, adversely impacting on patients' health and these survival rates. Currently, the approval process for cancer drugs in Ireland involves prolonged assessments by bodies such as the Health Products Regulatory Authority and the National Centre for Pharmacoeconomics. But this is after these drugs have already been evaluated for both safety and effectiveness by the European Medicines Agency. As a result, these lengthy and complex approval processes lead to significant delays. Now, Minister, according to the IDA, Ireland is the third largest net exporter of pharmaceuticals in the world, and yet it is one of the slowest countries in Europe to make these innovative medicines available to Irish patients. In terms of new cancer medicines, the wait in Ireland for these drugs is on average 673 days post the European Medicines Agency authorisation. Minister, that's 22 months. In contrast, other EU countries can make these medicines available to patients in as little as 102 days, while still managing budgets and conducting value for money assessments. It's important to note that it is only public patients who are left waiting 2 years or longer for access to these new medicines. This widens the divide in Ireland's two-tier health system because patients with health insurance can have immediate access to many of these drugs once they are approved by the European Medicines Agency. Minister, if we're serious about delivering on Sláintecare and ensuring that patients receive treatment based on medical need, we must raise public patient access to life-saving drugs to the accessibility standard of patients with private health insurance. At least in part, these delays are due to inadequate staffing, resulting in files sitting on desks awaiting assessments, or what is known as processing dead time. Tragically, Minister, there couldn't be a more apt phrase, because in reality, these delays mean patients, particularly those with aggressive or advanced cancers, may not receive potentially life-saving drugs in time. Consequently, their chances of survival diminish and their quality of life deteriorates. Minister, by addressing these unacceptable delays, we can ensure that patients receive the timely and effective treatment they deserve, improving their chances of survival and quality of life.
Thank you very much, Deputy Naughton, for raising what is a very important issue. And the first point I want to make is that the Government is committed to ensuring that patients in Ireland get timely access to new and innovative medicines. And in my time in the Department of Public Expenditure and Reform, this was an issue that we consulted and worked very closely with Minister Donnelly and his colleagues in the Department of Health, and we provided ring-fenced funding to ensure that new medicines could be made available in Ireland. So 148 new medicines have been approved in the last 3 years. That's based on the €98 million of new medicines funding, with total expenditure of €327.5 million to the end of 2023. And this has facilitated the introduction of 61 new cancer medicines in Ireland, bringing the total spend on cancer drugs in the last 3 years to over €600 million. So, for example, in 2021, we provided €50 million of ring-fence funding. That allowed 52 medicines to be approved, half of which were for cancer. In 2022, a further 30 million, and that allowed 60 medicines to be approved. 18 of these were for cancer. And last year, from €18 million funding, 36 medicines were approved, and 17 of these were for cancer. And of course that funding goes into the base, so that is a permanent funding, recurring funding every year, and once a particular medicine is approved, then it's essentially demand-led, and the funding will be provided to meet that demand. So that funding is in the base. In addition, you've made a relevant point in relation to staffing. We have provided an additional 34 staff across the pricing and reimbursement process. Now, funding was provided in the budget last autumn, and this year the HSE will launch an application tracker to increase transparency in the medicines assessment process. There is very close collaboration and a very good working relationship between the government and the industry on this issue. The Irish Pharmaceutical Healthcare Association engages on an ongoing basis with the Department of Health. This issue does get raised with me by IDA clients when I meet with them, and I am satisfied that the work that is well underway and the progress that we have made so far will be built upon, and we will continue to improve access to new innovative medicines here in Ireland, including for cancer. And when you look at the overall numbers, as I'm required to do in my job, almost €3 billion is being spent on new medicines. So it's vital that the HSE does robustly assess the offers from industry and maximises the use of its resources to purchase as many new medicines as possible, and that work will continue.
Thank you, Minister. Deputy.
Minister, patients with rare diseases face even greater challenges in accessing new treatments, or orphan drugs as they're often called. On average, they wait nearly 26 months. This delay is especially tragic, as about 30% of children with the rare disease pass away before their 5th birthday. The impact of these delays on patients with rare diseases, Minister, is profound. How can we defend a situation where these children may wait up to half of their short lives to access Irish manufactured medication that could prolong their life? We must prioritise the needs of patients with rare diseases and ensure that they receive timely access to treatments that could offer them the best hope of quality time with their loved ones. Minister, why not use the access for these children to these vital drugs as a pilot case to resolve the blockages in accessing Irish manufactured drugs for Irish patients? By doing so, we can make a significant difference to their lives and that of their families.
Minister.
Thanks very much, Deputy. And this is a priority area for the government, and it's one I'm very familiar with. I know very well companies like BioMarin, who operate in my own constituency in Cork and who focus on the manufacturing of drugs for rare diseases, orphan drugs, and we engage with them and others in the industry on an ongoing basis, because we want to ensure that people who are afflicted by very rare diseases, and very often young children whose life expectancy may be limited as a result, that they get access to those drugs as quickly as possible. My role is to ensure that we provide the appropriate funding to achieve that. Ireland ranks second among OECD 32 countries for the proportion of pharmaceutical expenditure which is covered by the state, and we are working to improve the efficiency and the speed of decision making. We can only make progress once companies actually apply through the Irish system, once they have received the necessary authorisation from the European Medicines Agency. But this issue is being actively managed. We are making progress, and we will continue to focus on that.